Hello, I'm Autumn Daughtry, a senior anchor for the National Library of Patient Rights and Advocacy. As we discussed in previous segments, the integrity of our public health system has been greatly compromised, and many of the essential programs that once protected the public health of all Americans has been eliminated. As patient advocates, we are very concerned with issues such as access to vaccines, the end of DEI or diversity, equity, and inclusion policies and programs, the reversal of well-established policies from the CDC, the Centers for Disease Control and Prevention, removing the United States from the World Health Organization, are just a few of the major changes that we have seen in the recent months. Today, we're going to be talking to a public health advocate who is a major commentator on many of these issues. It's Kelley Wells. Kelley Wells is a multidisciplinary professional with advanced training across public health, environmental science, healthcare, administration, and management. She earned a master's of public health with a specialization in environmental health from Liberty University and a Master of Education in Health and Wellness Education from the American College of Education. From the University of Maryland Global Campus, she holds multiple Masters of Science degrees, including Environmental Management, Healthcare Administration, Management with a specialization in Human Resource Management, Distant Education and Learning, and Biotechnology. She also completed a Master's of Business Administration in Organizational Development at Eastern University. Her academic foundation includes two Bachelors of Science degrees from Louisiana State University, A&M College, in Environmental Management System and Geography. Kelley is currently pursuing a Doctor's of Health Science with a concentration in Global Health from Purdue University Global, and a Master's of Science in Occupational Safety and Health from Columbia Southern University.
Thank you, Autumn, for that great introduction to our guest today. My name is Bob Kaiserman, and as Autumn mentioned, my guest today is Kelley Wells. Welcome, Kelley. Thank you for joining us. Please begin with a basic definition for our discussion today. Please tell the audience, what is public health?
Public health is the science of protecting and improving the health of families and communities through organized education, policymaking, and disease prevention.
Okay, and in your opinion, what's the current state of our public health system today?
I think the current state of our American public health system today is highly advanced in research, but structurally strained by fragmentation and inequities. Our system excels at clinical innovations and biosecurity protocols. However, my frontline analysis of the health insurance data for the Centers for Medicare and Medicaid Services highlights a critical gap. Many citizens struggle heavily with health literacy and navigating complex safety systems.
Okay. You're an observer and advocate for public health. What do you think are the most important issues that we're facing right now in this country?
The first issue is health disparities. Rural and marginalized communities consistently lack equitable access to quality health care and preventive infrastructure. The second one is system digitalization, AI risk. Integrating artificial intelligence into clinical workflows requires a rigid guidelines to safeguard patients' rights and compliance. And the third one is health literacy gaps. Communities cannot utilize preventive health resources effectively if educational materials are not accessible and culturally competent.
Okay. I know that you have great interest in environmental health and how that affects us on a daily basis. Could you explain exactly what is environmental health and why we should be concerned?
Environmental health addresses our physical, chemical, and biological surroundings directly impact biological systems. And the top priorities dealing with environmental health should be toxic chemical exposures and poor air quality because it's driving up our national chronic respiratory disease rates. Also, the built environments dictate whether a neighborhood has access to clean drinking water and green spaces. And also, I see it's important for us to have strong regulatory enforcement to mitigate large-scale medical emergencies.
Okay. I know you're a multidisciplinary professional. How have you have a broad education. How have you brought that together to promote public health initiatives?
The way I have done it, I deliberately built a multidisciplinary toolkit spanning from public health, environmental management, business, and behavioral education to tackle healthcare from every angle. I bridge these fields systematically through science and education, where I combined, health and wellness and a public health background to design evidence-based community interventions. Second, through administration and policy, that allows me to view public health initiatives through a lens of fiscal sustainability and strict regulatory compliance. And the last one is the cross-sector execution, which looks at, human resources, environmental safety, and project management, which ensures I can lead a complex, diverse teams through critical health rollouts.
Very nice. Good. Lastly, what are your thoughts about the future of public health? Not so much in this country, but globally.
I think the future of global public health hinges on biosecurity and preparedness, advanced digital learning networks, and ethical clinical trials. Like as we spoke, but concluding my doctoral work in global health convinces me that the future health crisis aspect respects no borders. We heavily leverage distance learning platforms to upskill global health care workers rapidly, and also institutional review boards representative for gene therapy trials. And I believe maintaining a rigorous ethics and protecting patient rights globally is paramount as medical technology accelerates.
Very neat. Very good. Very, very interesting. You've certainly helped us understand public health a lot better. So I appreciate your time and appreciate you being with us. And I'm Bob Kaiserman, and we'll see you next time on another interview.